so we're going to start and look at your hands here. Checking for skin integrity. Everything's warm, dry, and intact. Looking at your capillary refill. Okay. Actually, I can check skin turgor here. Okay. Now I'm going to be looking at your head. I'm looking for symmetry. I'm going to be palpating here for any lumps or bumps. I'm going to be feeling the occipital lymph nodes, the postauricular lymph nodes, the preauricular lymph nodes, tonsillar lymph nodes, the submandibular lymph nodes, submental lymph nodes. Can we turn? I'm going to be feeling the superior cervical lymph nodes, the deep cervical lymph nodes, and the posterior cervical lymph nodes. I'm going to have you shrug. I'm going to be feeling the supraclavicular lymph nodes and the infraclavicular lymph nodes. Relax. Okay, I'm going to be looking at your face. I'm looking for symmetry. I'm going to have you smile, puff up your cheeks. That is checking cranial nerve 7, which is the facial nerve. I'm going to be feeling here at the TMJ joint here. Then I'm going to be feeling for the masseter and the temporalis muscles. I'm going to have you chew, open and close your jaw. Okay, relax. That is testing cranial nerve 5, the trigeminal nerve. There were no pops or clicks. Now I'm going to be feeling your frontal sinuses for pain and pressure, and your maxillary sinuses for pain and pressure. Any pain or pressure there?
No.
Okay. I'm going to be looking at your eyes. I'm looking for symmetry. I'm looking at the hair distribution. I'm going to be looking at your conjunctiva. Look up and look down. Okay. I'm looking at the sclera. I'm looking at the cornea, the iris, and the pupils. So now I'm going to have you cover one eye. We're going to be checking cranial nerve 2, which is the optic nerve. And let me know when you see my hand in your peripheral vision.
Yes. Yes.
Okay.
Yes.
All right. Take that. I'm going to be shining this light between your eyes here. Okay, those are equal. Now we're going to be checking the pupillary reaction here. We're looking for the pupils to be round and equal to light and accommodation. Look straight ahead. Okay. Okay. Now for the eyes, we're going to be using the ophthalmoscope. I'm going to be checking for the red reflex. Okay, just look straight ahead. Okay, red reflex is present. I'm going to be looking in here. I'm looking at the background. I'm looking at the fundus. I'm looking at the vessels. I'm looking at the optic disc and the macula. Okay. I'm going to be looking at your nose next. Have you close one nostril and breathe in. Okay, checking for patency to the other side. Okay, now we're going to be looking in your nose here. I'm going to be looking at the mucosa. I'm looking at the septum and the turbinates on both sides. Okay, you can look in the ears. I'm going to be checking the ears here. I'm looking at the outside. I'm looking for symmetry. I'm feeling the pinna here. I'm feeling the tragus. Any pain?
No.
Okay. I'm going to be looking at the external auditory canal. I'm looking for debris or redness. I'm looking at the integrity of the tympanic membrane, the color. I'm looking at the bony structures and the cone of light. Bony structures are present. Tympanic membrane is pearly gray, and the cone of light is at 7 p.m. Good. Now we're going to be checking cranial nerve 8, which is the acoustic nerve. So I'm going to have you plug your ear on one side. Let me know when you hear my fingers rub together.
Yes.
Okay. Now we're going to be looking in the mouth. I'm going to be checking the mucosa. I'm looking at the dentition. I'm looking at the hard and soft palate. I'm looking at the uvula to see if it's midline. Say ah. Okay. Stick out your tongue. Say ah. Stick out your tongue. Okay. So by saying ah, I'm checking cranial nerve 9, which is the glossopharyngeal cranial nerve. I'm looking at the uvula, and then the gag reflex would be optic or cranial nerve 10, which is the vagus nerve, and then sticking out the tongue, what is that? For cranial nerve 12, which is the hypoglossal. Okay, so now we are going to be looking at the neck. I'm looking for symmetry. I'm looking at the trachea here to make sure that it's midline. Okay, I'm going to be feeling for the carotid pulse on both sides. I'm going to be listening to the carotid arteries, checking for bruits. I'll have you turn your head that way. Hold your breath. Okay. I'm going to come around here and feel for the thyroid. Both hands. Feel here for any nodules or lumps or bumps. I'll have you swallow. Okay. Feels normal. Now we're going to be checking range of motion in your neck. So I'm going to have you lean down, lean back, lean to the side, lean to the other side. Okay, lean back. I'm going to have you turn your head to one side and push against me. We're going to check strength. Okay, and the other way. Okay, and shrug your shoulders for me. This checks cranial nerve 11, which is the spinal process nerve. Then I'm going to push against you, shrug again. We're checking for shoulder strength here. Now I'm going to be having you spin around. We're going to be looking at the posterior chest. I'm looking for lumps or bumps, and I'm looking for symmetry. I'm palpating for lumps or bumps. Say 99.
99.
99.
99.
99.
99.
Deep breath in and out. Okay. We're looking for equal lung expansion. Now I'm going to be checking for CVA tenderness. Just relax. Let me know if this is tender.
No.
Okay.
No.
Okay. Now I'm going to be percussing the posterior chest here. Okay. I'm going to be listening. I'm also going to be examining the sinus process here to make sure there's no abnormalities. I'm going to be listening for lung sounds. Deep breath. Deep breath. Deep breath. Again. 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 And on the sides. One more time. Okay, how do you say 99?
99.
99.
99.
99.
99.
99.
99.
How do you say E?
E.
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 Testing for bronchophony. Okay, I'll have you come back around. I'm going to be looking at the anterior chest for symmetry. I'm going to be palpating for lumps or bumps. We're going to be doing percussion across the anterior chest here. Okay, I'm going to be listening. Oh, let's do 99.
99.
99.
99.
Okay, now I'm going to be listening here. Deep breath. Deep breath. And again. And again. Okay, I'm going to have you lean forward, kind of hunch your back over a bit more. I'm going to be listening at the aortic and pulmonary or pulmonic areas. I'm going to take a deep breath in and hold it. Okay. Now I'm going to be examining the axillary lymph nodes here, the epitrochlear lymph nodes here. I'm going to be feeling for the brachial pulse. What is that? And the radial pulse, which I would examine for 30 to 60 seconds, depending on the patient. Okay, now we're going to do some, oh, we cannot have this shut off. Okay. Is it still going? Yes, okay. So now we're gonna do some range of motion. So I'm gonna have you bring your arms up, spread your fingers apart, put them back together, rotate your arms. Okay, can you rotate your wrists? Bring your arms out, rotate. Okay, rotate your arms. Okay, bring your arms up, put them back. Okay, above you, bring them around. Okay, bring your arms up here. I'm gonna be pulling, don't let me pull. I'm gonna be pushing, don't let me push. Squeeze my fingers. Okay, equal. All right, now I'm going to be having you lay back. We're going to be looking at your heart and your belly. So I'm going to be examining the precordium here. I'm going to be looking for any pulsations or heaves. I'm going to be looking for the point of maximum impulse for the apical pulse. Okay, feels to be at the 5th intercostal space at the midclavicular line on the left side. I'm going to be listening to the apical pulse. I would listen for a full minute, examining the rate and the rhythm. Okay. Now I'm going to be examining the heart with the diaphragm and the bell. I'm going to listen first over the aortic area, which is at the 2nd intercostal space on the right sternal border. I move to the pulmonic area, which is the 2nd intercostal space on the left sternal border. I'd be moving to the Erb's point, which is at the 3rd intercostal space on the left sternal border. Moving to the tricuspid area, which is at the 4th intercostal space at the left sternal border. And moving to the mitral area, which is at the 5th intercostal space at the left midclavicular line. Listening here. So I'd listen, and then I'd flip it over, and I would do my bell. I would listen at the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. Okay, now I'm going to move down to the belly. I'm going to look at it. I'm going to see if there's any bumps or lumps and any scars that would notice surgical history or trauma. Then I'm going to listen to the belly and the right lower quadrant. And move around to all 4 quadrants. I'm going to listen for the aorta, the renal arteries, and the iliac arteries. Okay, then I'm going to be moving to percussion. Percuss all 4 areas. Okay, then I'm going to do light palpation, looking for tenderness, and then move to deep palpation. You're going to cross in front of me if you go. You're stuck. Okay, so then I'm going to be palpating over, or percussing over the spleen, starting low and moving my way up, or the liver. This is the liver. So I'm looking for the liver border on this side. Okay. So from here to here, it is about 7 centimeters. And then I'll be percussing here over the spleen. Let's start low. Okay, and then we'll palpate the liver here under the rib cage. And then palpate the spleen. And try and palpate the kidneys here. And palpate the kidneys here. Okay. All right, so now we're going to move to the lower extremities. I'm going to have you, I would be looking at the skin, for any discoloration, for any swelling, any hair distribution. I'll be checking the popliteal pulse, which is under the knee. I'll be looking at the posterior tibial pulse here, and the dorsalis pedis pulse. Okay, now we're going to be checking range of motion, so I'm going to have you bring this leg out to the side and back in. I'm going to have you bend your knee up, okay, bring it to your belly, and back down. We would repeat that on both sides. You can relax that down. I'm going to have you bring your heel across your shin, and do it again for the other side. Okay, since we can see it on the camera, I'm going to have you rotate both ankles one at a time. a circular motion. Same with the other side. Okay, point your toes and then bring them back up. Okay, good. You can relax. I'm going to have you sit up now and swing your feet around. Okay, now we're going to do rapid alternating movements. So across your foot like this. Okay. I'm going to have you close your eyes. I'm going to put an object in your hand, and I'm going to have you tell me what you think it is.
A quarter.
Okay? Alright. Now I'm going to have you open your eyes. Let me bring your hand out here. Okay, so we're going to check your position sense. So this would be up. Okay? This would be down. Your finger. Have you close your eyes for me, and I'm going to have you tell me which position your fingers are in.
Down.
Okay?
Up.
Okay, good there. Now we're going to check sensations. So I have the sharp sensation. Okay, feel the
Okay.
sharp and the dull.
Okay.
All right, so I'm gonna have you close your eyes, and I'm gonna have you tell me what sensation you feel.
Sharp. Sharp.
Okay.
Dull. Dull. Sharp. 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 Dull. Dull.
Okay, we're gonna move to the lower extremities. Same thing here. Tell me if it's sharp or dull.
Dull. Sharp.
Okay.
Sharp. Dull. Dull.
Okay.
Dull. Sharp. Sharp.
All right. Now I'm gonna have you stand up for me. I'm gonna have you bring your feet together and your arms at your side. I'm gonna have you close your eyes. We're gonna check the Romberg test. This is testing for balance. I'd have you stand here for about 30 seconds or so to make sure you don't have any balance issues. But we're gonna move on. So I'll have you open your eyes. I'll have you bend and touch your toes. Okay, I'm gonna be checking your spine here for signs of scoliosis or any other deviations here. Okay, you can stand up. I'm gonna have you lean all the way back. Stretch your back. Yep, we're just checking range of motion. And then lean to your right side. And lean to your left side. And turn to your right. Kind of spin, yep. And spin to your left. Okay, and now I'm gonna have you stop there. We're gonna walk on our tiptoes forward. Okay, and I'll have you stop and turn around, and you're gonna walk on your heels to come back. Okay, and I believe that's it.